If you're tired of that nagging knee pain calling the shots in your life, you've probably looked into options that don't involve surgery. Well, today we're going to dive deep into one of those options, knee gel injections. We're going to break down what they are, exactly how they work, and help you figure out if they might be something worth talking to your doctor about.
You know, this quote just hits home, doesn't it? Because chronic knee pain, it's not just a small ache. It gets in the way of everything. It's a constant reminder of why finding a real solution is just so important to so many of us.
Yeah, it's that daily grind, that stiffness and pain that can really wear you down. So the big question is, what can you actually do about it?
So let's talk about these gel shots. We're going to peel back the layers and look at the science of what they're actually supposed to be doing inside your knee joint.
Okay, the official medical term is a mouthful, viscosupplementation. But all you really need to know is the key ingredient here is something your body already produces. It's called hyaluronic acid. You can think of it as the natural oil or lubricant for your joints. The problem is, in a knee with arthritis, that fluid gets thin and watery and it doesn't cushion things anymore. This whole procedure is designed to put that good, thick lubricant back in.
And this is the perfect way to think about it. This isn't a painkiller, not in the way we usually think of one. It's much more like getting an oil change for your knee. The whole idea is to restore that cushion and that smooth glide that a healthy joint is supposed to have.
Now, you might have heard some of these brand names before, especially if you've already chatted with your doctor. They all use hyaluronic acid, but they come in different formulas. That's why some, like Durolane, might be a single shot, while others could be a series of 3 or more injections.
All right, section 3. Let's get into the nitty-gritty. What is it actually like to get one of these injections? We're going to walk through the whole thing, from what to do before to what happens right after.
So the good news is, getting ready for this is super straightforward. First, your doctor makes sure this is the right treatment for you. Then you go over your medical history, and honestly, the rest is just simple stuff, like planning to take it easy for the rest of the day and, wearing comfy pants you can easily roll up. And the procedure itself? It's surprisingly fast. They clean the area, numb it up a bit, and this next part is really important. They often use an ultrasound to guide the needle. That helps make sure the gel gets into the exact right spot. The whole time you're in the room is usually less than half an hour. And maybe the best part for a lot of people, you get up and walk right out on your own.
So what happens after you walk out? Well, the game plan is pretty simple. You'll want to take it easy for a couple of days, so no heavy lifting or running a marathon. But as you can see, the downtime is really minimal. Most people with a desk job are back at it the very next day.
Okay, on to a really common question. How are these gel shots any different from cortisone shots? I mean, they're both injections for your knee, right? Well, yes, but they are totally different tools designed for completely different jobs.
This little chart here is incredibly helpful. Look, cortisone is all about speed. It's like a fire extinguisher for a hot, swollen, angry joint. It puts out the inflammation fast. But gel shots, they play the long game. They work slower, but the relief is meant to last a lot longer because they're not fighting inflammation. They're improving the mechanics of the joint, the lubrication and the cushioning.
Which brings us to the million-dollar question, right? After all that, are these gel injections actually worth it for managing knee pain?
So are they worth it? For the right person, someone with that mild to moderate arthritis, the answer is often a big yes. But here's the absolute key. The injection is not a magic bullet. It's not the whole solution. It works best when it's just one part of a bigger, more comprehensive game plan.
And this is so important for setting your expectations. This is not an overnight fix. As you can see from this timeline, the benefits kind of build up slowly over several weeks. The goal here isn't instant relief. It's long-lasting relief that can carry you for months.
Now, if you take away one thing from this entire explainer, let it be this. The injection itself doesn't fix the problem. What it does is create a window of opportunity. It dials down the pain just enough so that you can do the other important stuff, the physical therapy, the strengthening exercises, the things that make a real long-term difference. The shot isn't the therapy. It's what makes the real therapy possible.
All right, last section. Let's cover the essentials, the practical safety information you absolutely need to know, what side effects are normal, and what are the red flags to watch out for.
The good news is, for most people, any side effects are really minor and they don't last long. You might get a little soreness, warmth, or swelling right where you got the shot for a day or two. That's pretty normal. It's just your body getting used to the new fluid.
But, and this is super important, you have to know the difference between what's normal and what's not. These here are the red flags.
Things like a fever or pain that gets worse instead of better after a couple of days, those are not typical. If you experience any of these, you need to call your doctor's office right away.
So, at the end of the day, the question isn't really, should I get a gel shot? The real question is it time for me to build a smarter, more complete plan for my knee pain? And for a lot of people, these injections can be a really powerful part of that plan. We hope this has given you the right information and the right questions to take with you to your next doctor's visit.